Hey, y'all, welcome to another episode of Confessions of a Male Gynecologist. I am your host, Dr. Shawn Tassone, America's Holistic Gynecologist, board certified in OBGYN, integrative medicine, also certified minimally invasive gynecologic surgery, subspecialty, and author of the book, The Hormone Balance Bible. I would run over to Amazon right now and get a copy of that. It's like $14, 500 pages, all you ever wanted to know about hormones, hormone replacement labs. I put the top 12 most common hormone imbalances into archetype explanations so that you have a better understanding of the symptoms and the issues with those hormones. Now, I want to talk about something this week that has come up for me over and over and over again, and a very charged topic. I'm somewhat surprised at how volatile this topic was. I had no idea, and that's the thyroid. I'm literally amazed at the amount of vitriol and hatred there is in the world. But when you start talking about thyroid, people get like crazy. They get that look in their eye like they're a serial killer or something. And it's really kind of interesting because I kind of felt like maybe a lot of women weren't getting a good amount of thyroid information because most doctors will look at labs and maybe look at a TSH or, free T4, but that's it. And then they'll go, oh, everything's normal, even though you feel like garbage. So in my book, The Hormone Balance Bible, I have two archetypes for the thyroid: hypothyroid, which is the underdog, and hyperthyroid, which is the overachiever. And neither of them are particularly good because nobody wants to be hyper or hypothyroid. I would venture to say if I saw 1,000 patients, I would probably see overt hypothyroidism maybe 2 times, hyperthyroidism maybe once. However, there is something that we call subclinical hypothyroidism, and that's a woman who has all the symptoms of hypothyroidism: brain fog, weight gain, feeling cold all the time, hair thinning, decreased energy, maybe swelling in the lower shin area, and yet her labs are totally normal. But they're at the bottom of normal. And I talk about this all the time, how normal isn't always normal. It's maybe not your normal. And certainly if you have all the symptoms, then you might qualify for some hormone replacement around the thyroid gland. But what I wanted to do today, I have a few episodes, if you go back, on thyroid. I've talked to Alan Christensen. I've talked to Isabella Wentz, the author, both of them authors of thyroid books. And they are kind of my go-to people on the thyroid, but I do have some opinions. And I just wanted to talk this time about the thyroid labs because there seems to be a lot of misinformation about thyroid labs. There's 2 hormones in your body that you need physically to survive, that you need these 2 hormones to live. And that is the thyroid and cortisol from the adrenal glands. If you don't have either of those 2 hormones, you die. Pure and simple. You need them to survive. All the other hormones, estrogen, progesterone, testosterone, DHEA, you don't need them to live. You might be fairly miserable, but you don't necessarily need them to live. You need them to live a productive, happy life. So thyroid's pretty important. And the number one test that we look at for thyroid, that we've looked at for years, is something called thyroid stimulating hormone. Now, thyroid stimulating hormone is a regulator of thyroid function, and it has influence over certain bodily processes. It's produced in the pituitary gland and plays a role in maintaining thyroid hormone levels in the body. So technically, TSH is not a thyroid hormone. It's a pituitary hormone, not a thyroid hormone. It's a hormone that signals the thyroid what to do, but it has no direct thyroid action. But you want to understand your TSH because it's an essential piece at looking at your thyroid. Now, something that people get conflicted or confused about is the level of the thyroid. So sometimes people will see an elevated TSH and they think that that means they're hyperthyroid. What the TSH is it's the brain talking to your thyroid. So the higher your TSH is, that means your brain is screaming at your thyroid to make more because you don't have enough thyroid. So high TSH means hypothyroidism. If your TSH is super low, that means that your brain is no longer communicating with your thyroid because there's way too much thyroid in your system. And occasionally I will see this because some people, when they're on thyroid meds, are actually taking too much. So another way you can actually really lower TSH is if you're taking iodine supplements. But I digress. So what is TSH? TSH, or thyroid stimulating hormone, is basically a glycoprotein that's produced in the brain, and it's a biofeedback release. So the higher your thyroid, the lower your TSH, etc. And it's released into the circulation in response to decreasing levels. So if levels of your actual free T3 are low, the TSH is going to go up. It's produced there's two parts to the pituitary. There's the anterior, or the front, and the posterior, or the back. And it's produced in the anterior pituitary gland. The pituitary is about a pea-sized structure in your brain. And they have cells. They're cells in the pituitary called thyrotrophs. And thyrotrophs synthesize TSH in response to signals from the brain above called the hypothalamus. The hypothalamus releases something called thyrotropin releasing hormone, which stimulates those thyrotrophs in the pituitary to release TSH. So the hypothalamus has thyrotropin releasing hormone, stimulates the thyrotrophs in the pituitary, which then make your TSH, which then goes to the thyroid gland. And basically you start making thyroid hormone. It initiates the production and secretion of T4 and T3. T3 being the active form, T4 being the storage form, which we will talk about in a minute. So, as I said, just to reiterate, high TSH means that you're on the hypothyroid side. Low TSH means that you have too much thyroid. So again, what is this, what I call subclinical hypothyroidism? It's basically a condition where TSH is elevated. And when I say elevated, it could still be in the normal range. I kind of like to see the TSH down around 1. So maybe it's 2.9 or 3. To me, that's a little bit of an elevated TSH. So subclinical hypothyroidism is where you have an elevated TSH and some mild thyroid dysfunction, particularly with T4, but also T3. And you have symptoms. So basically, you want to look at all of the labs. Now, most doctors, when they order a TSH in most labs will come also with a reflex to free T4, meaning that they will do the TSH, and if the TSH is a little bit off, they will also run a free T4. I don't order it that way because I don't want the lab to go ahead and decide what to do. I want to tell them what to do. So I'll go ahead and just say, I want a TSH, I want a free T4, I want a free T3. So things you're going to want to do is go ahead to your doctor, get this TSH lab, but understand that it's going to be interpreted in some crazy ways. So let's look at free thyroxine, which is the free T4. So T4 is thyroxine. Free thyroxine is basically a crucial hormone produced in the thyroid gland. The thyroid, actually, I didn't say this, but it's kind of a butterfly-shaped organ that's in the kind of the base of your neck. The hormone itself, whenever we say free, like free testosterone, free T3, free T4, it's because it's not attached to any proteins in your blood. Now, thyroid hormones will attach to something called thyroid binding globulin, just like we have sex hormone binding globulin, which binds to testosterone. Thyroid binding globulin will bind the free T3 and make it, or free T4 and make it inactive. So the free hormone means that it's readily accessible for the body. Free T4 plays a vital role in metabolism. And it's how you basically take your food and turn it into energy. However, if you have a high free T4, it might mean that your thyroid gland is working too hard, meaning you're making too much. And there's a bunch of reasons for that. Basically, an autoimmune condition called Graves' disease, where your body's immune system accidentally attacks your thyroid gland, making it produce more hormones than you need because it's being stimulated by these antibodies. Another reason could be a growth on your thyroid, like a tumor or a nodule or goiter, and these will make you make more hormones. So you want to keep an eye on that. Symptoms are going to be things like anxiety, weight loss, difficulty sleeping, feeling hot or sweaty. I remember this vividly. I had a patient she was from England, and it was when I was in the military in Lawton, Oklahoma. And she and her husband came over from England, and they were at the base, and she had a baby. But after she had the baby, I saw her one day in the clinic, and she was like 30 pounds lighter, but she didn't look good. Like, she looked too thin or kind of sickly. And I said, geez, what's going on? She's like, I can't sleep. She said, I literally, I haven't slept in days. And I ran some labs. Sure enough, she was hyperthyroid. So something to look for. Now, if your levels are low, it could mean that the thyroid isn't making enough of the hormones for various reasons. Now, that can be on the flip side. So let's say you have something like Hashimoto's, where again, you have thyroid peroxidase antibodies and they're attacking your thyroid. Eventually, if they continue to attack, it's going to start destroying your thyroid gland. So over time, the antibodies will drive your hormones down by destroying the thyroid gland, which is why I had a lady yesterday say my doctor won't check my thyroid peroxidase antibodies because they say it's not worth it. There's nothing they can do about it. Totally untrue. One of the things I would like to do is look at the activity of your thyroid antibodies, because if you have, let's say, a TPOA over 600 and you start working on getting the inflammation down, you might prolong the life of your thyroid. So we have free T4. Free T3, or triiodothyronine, is the active form of your thyroid hormone, and simply called basically free T3. It's basically way more active than free T4, has a bigger effect on your body, crucial for many processes such as managing your metabolism, again, turning food into energy, and it helps with the heart function, digestion, muscle control, brain development, and helps keep your bones healthy as well. So if your levels are high, again, it means that you're hyperthyroid. Why are you hyperthyroid? Well, it can be a lot of things. It can be those antibodies I talked about. You could be taking too much thyroid hormone. Some women take too much. If you're low, which I see all the time, then, and I mean low normal. So let's say the range on a free T3 is 2.2 to 4.4 or something along those lines. And you come in at 2.3 and you have all the symptoms, I would call that subclinical hypothyroidism. Now, what happens is free T4 is mainly storage, mainly inactive hormone. Free T3 is active. So what I do is I have an analogy, because I think it's always easier for people to understand things if you break it down into verbiage that is more relatable. And so I look at the thyroid as your bank account, your money. Free T4 is money in the bank. It doesn't do a whole lot. You might get $1 of interest here and there, but it's not doing a whole lot. Free T3 is you pulling that money out and spending it. So there's medications on the market: tyrosine, levothyroxine, Levoxyl, Synthroid. These are all T4, and they're giving you a storage hormone. So let's say you have that 2.3 on your free T3 and you have a lot of symptoms of hypothyroidism, and I give you Synthroid. Well, you might convert some of that into T3, but probably not a ton of it. So it's like looking at someone and going, well, your bank account's fine, but I'm going to give you $100,000. I'm going to put it in your bank account, but you can't ever spend any of it. It doesn't do any good. To me, that's what Synthroid does. It really doesn't do a whole lot because you have to convert it into T3. I prefer to give a medication that has both T4 and T3 because then not only are we getting your bank account in shape, but we're also giving you money to spend. It's a double whammy. I personally just think it works better. That's why I like to use NP thyroid, or sometimes I'll compound a thyroid medication because I just feel like it's a better way to do things. So let's look at the antibodies. Thyroid peroxidase antibodies. I order this one all the time. Anti-thyroid peroxidase antibodies are antibodies produced by the immune system that mistakenly targets and attacks thyroid peroxidase, which is an enzyme crucial for production of thyroid hormones. So it basically attacks your thyroid gland, the processes that are involved. It attacks thyroid peroxidase, which helps you make thyroid hormones. So thyroid peroxidase catalyzes the addition of iodine to thyroglobulin. And this is a step in hormone synthesis. So when the immune system attacks the TPO, or the thyroid peroxidase, and impairs hormone production, these antibodies disrupt the function of thyroid processes. The presence of these antibodies is also a significant indication of an autoimmune disease, such as Hashimoto's thyroiditis or Graves' disease. And that's why we see these elevated antibodies. Now, that being said, you can get antibodies to come down, decrease gluten, decrease dairy, using a supplement like Zyflamen that has holy basil, rosemary, turmeric, anti-inflammatory properties, using a medication, a compound medication like low-dose naltrexone, which increases your body's natural production of endorphins. And endorphins go around and they clean up inflammation. So that can help as well. Basically, the antibodies that we look for, these anti-TPO antibodies that we test for, will go up and down based on inflammation in your body. So if you look at gluten and dairy, highly inflammatory, they will, it's like pouring gasoline on a fire. So when you have something like Hashimoto's disease, which is chronic autoimmune thyroiditis, and it's the most common cause of hypothyroidism in most developed countries, obviously more common in women. As I said, it attacks the thyroid gland, which eventually makes the thyroid gland more fibrotic and dysfunctional. Central to the process is that it also attacks the enzymes, which makes it hard for you to convert T4 to T3. And antibodies are very common. They're a marker for the disease. I know a lot of doctors, once they see antibodies, they'll diagnose it, but they won't ever check them again because they don't think it's necessary. I disagree in the sense that I think that we can monitor our treatment based on if the antibodies are going up or down. And I've seen them go down many, many times. So let's talk a little bit about Graves' disease. Graves' disease is another thyroid issue. It's the people that have like kind of bulgy eyes, like you can see the whites all around their pupils because their eyes are a little bit bulging. And that's because the elevated thyroglobulin antibodies that happen in here, or the anti-antibody or the anti-TPO antibodies, will attack the optic nerve area and push the eyeball out a little bit due to inflammation. So that can be a problem as well. So basically, I check for thyroid peroxidase antibodies, and usually in most labs, it's either above 19 or above 35 that's considered abnormal, because about 80% of the population will have some antibodies. The question, though, that I always have is why? Why do we have elevated antibodies? We shouldn't technically have antibodies to our own thyroid gland, but it does happen, and that's why a lot of doctors will say they don't do anything about it because it's very common finding. I personally just don't think it's something that we need to just leave alone. I think we have to be a little bit aggressive with it and treat it. And the big controversial marker that I want to talk about at the end here is something called reverse T3. And the reason that I was stimulated to do this little podcast informative session is because I made a comment on Instagram that I'm not a big fan of testing for reverse T3. And it's because it doesn't usually change the outcome of my treatment. Also, elevated reverse T3 is one of those things that is rare. And it usually happens in people that are sick, HIV, severe autoimmune disease, kidney failure, cancers, things like that. So, I mean, if the patient comes in and she's totally fine, I'm not going to check her reverse T3. Reverse T3 is a special hormone that's created by the thyroid gland that basically it's involved in the process of the conversion from T4 into T3. Reverse T3, for some of us, feels like it's a minor character. Others feel like it's a major character. However, it does have a big role in the body's hormone balance. It does help work as a control mechanism. And what it does is it can bind onto the receptors that T3 binds onto. And so if it's high, it could bind to the receptor, but it's technically inactive. So it may not do anything and it blocks the receptor. It's kind of like what estrone does to estradiol. Women that take Biest has estradiol and estriol. I don't mean estrone, I meant estriol. So when you give someone estriol, the estriol is a very weak estrogen, meaning it binds the receptor, but it doesn't have much of an effect. And so what happens is if estriol binds your estrogen receptor, it's going to keep the strong estradiol off the receptor. So you're kind of chasing your own tail. So that's what can happen if you have an elevated reverse T3. An elevated reverse T3 might mean that your body's trying to save energy because of stress. So that's the other reason I don't check a reverse T3 is it's basically elevated in people that are stressed. And who isn't stressed nowadays? Obviously, stress can happen from a multitude of things, from illnesses to dieting to high physical or emotional stress, not sleeping, and even some medications like beta blockers and steroids. And so, again, I'm not a huge fan. I don't think that here's the thing. If somebody comes to me and they want a free T3 drawn, I'll draw it. I mean, I'm not here to tell you no. That's like you're an adult. I'm an adult. You tell me you want a lab and your insurance is going to pay for it, or you're fine paying for it yourself, then I don't care. I'll order it. I have no desire to make people not get what they want. And so point being is that I'm okay with ordering it. I just don't think it's as necessary as we make it out to be. Some people will basically go off on these tangents thinking they have to have all these things done so that they can look smart and they can feel smart and they can be smart, when the reality is they're not smart because it's not something that really needs to be ordered very much. So that being said, thyroid is obviously super crucial to hormone balance, metabolism, weight gain. I see women all the time who have subclinical hypothyroidism. I put them usually on NP Thyroid. I think it's a great medication. It helps a lot of women. There is no, one size fits all, especially when it comes to thyroid, but you also don't want to overdose people because it can be very dangerous. You can raise their resting heart rate. You can make them feel jittery, like they just had 2 pots of coffee. So you really want to keep an eye on it and make sure you're not overdosing people. That being said, again, I would direct you to the chapters in my book, The Underdog and the Overachiever, where I talk about the thyroid in more depth. I just wanted to give you a quick rundown on the different labs and why they're ordered. Why I don't always order a reverse T3. I think that the amazing amount of information that's available on the internet is, unfortunately, a lot of that's out there is being written by people with absolutely no medical background who are trying to sell you supplements because, that's the way of the world. I think there are programs out there. I won't name the pseudo doctor that's out there doing this who charges $10,000 for the program, which I think is asinine. You should be able to get hormone help and not have to pay that much. Maybe 1/20th of that, you could get hormone help. I mean, whatever you feel is important for you, obviously, is the best approach, but you also don't need to spend a ton of money. So, thyroid gland, super important, obviously. You need to have it or you die. Not something that needs to be messed with too much, because you can actually make somebody sick if you give them too much. I don't think it's something that you should take lightly. And you should definitely look at things with regards to how you respond, because the other thing about hormones and hormone medication is that it takes time to feel the results. Thyroid isn't necessarily going to hit you in a day or two. It might take weeks, and it might take weeks for your labs to readjust. So I never go up on doses of thyroid unless I have labs. That's it. That's it on thyroid. If you have any questions, obviously, please feel free to reach out. You can make appointments with me. I do telemedicine in about 35 states. If you go to my Instagram page, my second pinned post on Instagram is all the states where I am currently licensed. I'd be more than happy to help you on your journey. Please let me know if there's anything I can do to help you. Remember, you're not alone, and normal isn't always normal. So if you don't feel normal and they're telling you that your labs look normal and you want to find more information, I'm here. Take care. Have a great weekend.